We're here with Chris Kalkhof, who is in fact Director Strategic Solutions at Navigant Consulting. Tell folks what Navigant's all about.
Navigant is very much in the healthcare practice about helping organizations through the change process, through the transformation process in terms of evolving their organization from today's type of business operating model to what they need to have to be successful tomorrow.
Let's talk about this, Chris. You know, one of the things that you told our producers you wanted to talk about was transforming the payment system in healthcare. What's wrong with the current payment system?
The current payment system, the fee-for-service model, really rewards individuals who provide the care no matter what the outcome is. It's a volume-driven system, and so it's not really designed necessarily around the needs of the patient, the needs of the physician, as opposed to more of a reimbursement model. So payment transformation really is about looking at how do we create value at a patient level, how do we create value at a stakeholder level, and hold providers more accountable for the care they deliver, the resources they use, and the outcomes they deliver.
So let's talk about this a little bit. This summit's about collaborations, partnerships. So if we're talking, Chris, about how to collaborate, how to partner, what is the connection between collaborating and bringing down the cost of healthcare?
It's a two-part equation. So in today's world, there's the provider part of the equation and there's the payer part of the equation. To really be able to change the care model, which is where the value creation occurs, there needs to be a lot of data. And so what providers have today in the traditional models, they only have data on patients that they treat. They don't really know what happens to that patient across an episode of care, particularly when it goes outside their four walls. So when they collaborate with a payer, they can work together to use the data to figure out what's the best way to deliver care for this patient across this type of episode of care for the optimal outcome. And that's just not really available in the traditional fee-for-service model.
Yeah, this whole fee-for-service model has been talked about a lot. The other thing you hear a lot about, and you'll hear a lot about today in this summit about collaborating, is population health. One of the things that we've learned about the healthcare field is there's a lot of jargon. That's one of the terms out there today. If you were to break down, Chris, the term population health, so that the average person watching on public television, FiOS, and everywhere checking us out right now, population health means what?
It's really about the overall type of healthcare delivery needs that are defined, usually in healthcare terms, an attributed population has. So whether it's a Medicare population or a Medicaid population or the traditional commercial population, those individuals break down into different age and gender categories, and depending on their health disease status, they have different access needs. So it's really about having a comprehensive, holistic type of view on the patient care needs, everything from the preventative side through the acute side, the post-acute, and even into end of life.
Are we doing that now?
We're doing it now, but it tends to be very fragmented because there's a disconnect on data flow, there's a disconnect on information, there's oftentimes a lot of
Give us, for instance, because there's a disconnect on data flow. It's hard to follow that lingo.
I'm a patient, I'm admitted into a hospital, ED, for a particular condition related to my chronic disease. I am treated, I'm stabilized, I'm released. That information doesn't necessarily flow back to the physician, their primary care physician, their specialist physician. They may be unaware of tests that were performed, and additional diagnostic tests may be ordered that are duplicative and not necessarily in the benefit of the patient. And if they don't have the information they need to really understand the condition of the patient, and then it becomes very difficult for them to decide what's the most appropriate treatment as a next step.
Isn't this difficult, though, Chris, when you talk about changing the payment model, right, from fee to service to a very different model? I mean, what does that actually mean to the patient, and how does the patient deal with that?
At a patient level, if it's done right, it's really seamless, but the mechanisms behind it are how the patient is navigated. Instead of Dr. Jones sending to Dr. Smith, because they've always done that, Dr. Jones says, relative to this patient, i.e. the population health, I should not be sending them to Dr. Smith just because I've been referring to him for 20 years. I need to send it to Dr. Abuelo, you know, and because she specializes in these chronic kinds of disease and these complications, and she's better able to return that patient back to daily activities than having them migrate through the system one stop after another, trying to find out who can really best work with my medical condition.
What caused us to do all this? I mean, like, what's the problem that caused us to say, hey, the status quo is just not working?
The biggest driving problem has been the cost of healthcare as a percentage of the GNP, as a
gross national product.
gross national product, is a per member per month kind of situation. That is the aggregate cost of care we see translated into premiums, and also the annual trend, which far exceeds the CPI, or
Consumer Price Index.
Consumer Price Index.
There's a lot of jargon in healthcare, isn't there?
There is a ton of jargon. Some of the names are very long.
Yes. But we had to get that cost down.
Yes, we need to get the cost down, at least moderate the cost. Most of today's type of value-based payment models are designed to ideally reduce that per member per month spend to some degree, but more so geared towards changing the growth trend. Instead of a 7 or 8% trend, we may change the trajectory into a 1 or 2% trend.
It still will go up, but not as quickly?
Correct, if all works well. It's like the perfect golf swing. Not my golf swing, but
Not mine.
you have to get all 20 things right at the same time.
Thank you, Chris.
Thank you very much, Steve.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by Health Republic Insurance of New Jersey, the New Jersey Education Association, Wells Fargo, New Jersey Sharing Network, the Healthcare Foundation of New Jersey, MD Advantage Insurance Company of New Jersey, and by NJ Best. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.